All right, hi everyone, welcome back to clinic at Harley Academy. My name's Dr. Tristan Mehta, and today we're joined by Charlotte in clinic. Welcome, Charlotte.
Hi.
So today we're going to be showing a biostimulatory treatment, and we're going to be using a product called Ellansé. And what's interesting about these products is that they can be typically used for patients that have signs of aging, but they can also be used quite similar structurally like hyaluronic acid gels. And so we've got Charlotte, who obviously doesn't have any major signs of any aging, but still would be a really good candidate for this skin regeneration, this biostimulatory process. Charlotte's previously had very minor amounts of injectable treatments, and is here today just for a kind of full face assessment and a chat. So let's start off with Charlotte. Tell us, welcome to clinic.
Hi.
Could you tell us a little bit about what's the main concerns for you?
Just mild jowling at the bottom here, so it feels a bit heavy around the bottom of my face, and just requiring a little bit of balance on the cheek. On the cheeks. Very good. And can we ask how old you are? 40.
You're 40. So I think you'd all agree Charlotte looks very good for 40. She's very well preserved in terms of her volume, in terms of laxity. There's very little clear signs of the traditional signs of aging, which would be kind of volume loss here and jowling. And so what we're looking for here is this a really good case to demonstrate how these biostimulators can be used for this revitalization of the skin, but also to create this structural component as we stimulate the deeper collagen in the tissues. We do have a very beautiful upper face, symmetrical eyebrows, convex forehead, and very full temples. The volume in the temples is very, very youthful. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. I noticed in the midface, we start to lose a little bit of the definition of the cheekbones laterally. And I think we have excellent anterior projection here, but then we start to lose a little bit of that really nice definition that I think would look really good for Charlotte's in the lateral aspects of the cheek. I do notice here that we start to see a little bit of laxity of the skin. I think this is what's starting to contribute to this very early, I wouldn't call it a jowl, okay, but we're starting to see a little bit of, I'll call it an interruption along the jawline. And so if we use a biostimulator to really try and tighten the skin and improve the skin back here, we will notice a more striking jawline. And that will also reduce the little divot that's appearing just to the side of the chin here. If you look all the way on profile, you may notice that Charlotte would benefit from a tiny bit of chin projection as well, just to balance the profile of the face. But otherwise, if you look at the rest of the face, I see a youthful patient in her, I would say, early to mid-30s. And so what we're trying to do with the biostimulator here is just try and improve the tightness and the condition of the skin in the lateral aspect of the face, so that the whole face is in keeping with that presentation. So does that sound good?
Yeah, sounds very good.
The final thing I wanted to point out is that we do also have hyaluronic acid gels, and we can use those in strategic places where there's deep volume that you want to create projection. And you may notice that we could benefit a little bit from some deep volume down at the base of the nose. That's the piriform fossa. And so it may be tempting to do an injection down here, because as we age, we lose this maxillary bone support and the angle decreases and we start to get these shadows. And so a single injection either side at the base of the nose, the piriform, deep piriform space, could be of benefit to Charlotte as well. So with that in mind, let's get ready for the treatment, and we'll show you how we reconstitute and use Ellansé, the biostimulator.
Hello, I am Dr. Harriet. I am one of the aesthetic doctors here at Harley Academy. My time here, I spend doing treatments on patients and also training lots of our medical professionals in aesthetic medicine. I'm also the medical director here, so I spend lots of my time overseeing patient treatments, making sure everyone is safe and happy.
Okay, so we've got Dr. Harriet joining me in clinic today, and Harriet's one of our senior medical trainers, and she's going to be helping me to reconstitute the Ellansé. So Harriet, talk us through your plan.
So I have got my syringe of Ellansé here. It comes in a 1 ml syringe, and you can see it's like a opaque white gel. I've already drawn up some lidocaine. I've got 0.2 mils of lidocaine here, and then I've just got a connector that I'm going to use to mix the two. The two actually mix very nicely together. It doesn't take too much effort, but using this connector is really helpful. So try not to touch any of the ends. I'm going to connect the gel on now. And you do want to try and do it nice and firm. The syringe that you've got your lidocaine in, it's helpful if it's got a lure lock, because you are now going to use a little bit of pressure to just agitate the gels between the two syringes to mix up the lidocaine nice and evenly throughout your Ellansé. That leaves you with 1.2 mils of product to now inject.
Okay, so let's start by marking up our treatment plan for our Ellansé treatment today. First thing I'm going to do is find the bony landmarks I always like to draw on my patients. So we have the temporal crest, and we have the superior aspect of the zygomatic arch. So this gives us our temporal fossa posteriorly. I'm also going to mark on the underside of the zygomatic arch as well. And so you can see between these lines, the direction of the cheekbone is in this direction. And that's going to be important because I'm going to try and create some of this structure underneath the skin that follows her natural cheekbone to give this beautiful lift to the lateral midface. The other thing I want to point out is something called the line of ligaments. So if we connect here the lateral orbital thickening to the origin of the zygomatic cutaneous ligaments and the mandibular ligaments, and you draw a line from the temple through these ligament insertions, what we see here is we can divide the mobile midface from the passive midface. And I'm going to demonstrate that right now. So if I put my finger here on the cheekbone, if you give me a really big smile and relax, my finger doesn't move. Smile again and relax. Where I put my finger here and then smile and then relax, you can see that it's moving on again. Smile and relax. It's moving my finger. Okay, so what I'm demonstrating there is that the muscles in front of this line of ligaments are responsible for lifting the corner of the mouth and lifting the lip and smiling and expressing. And those muscles mean that we have a very active component of the midface. If we put a lot of volume on top of those muscles, then the patient, when they smile, can look very overfilled and unnatural. Whereas if we're trying to inject behind those muscles, we're not worrying about this tissue moving on expression. What we're thinking about here is actually injecting either deep or superficial or acceptable. And when we're using a biostimulator, we want to be treating just underneath the skin to get the most dermal stimulation. And so one of the advantages of using a biostimulation in a patient like this, when we're trying to lift along the jawline like this, is that we can treat this entire area just under the skin with Ellansé. And what it will do is we will create this beautiful biostimulatory effect, and we'll get this lateral lifting direction, this vector. And we don't have to worry about injecting just superficially, because we're not worried about that product moving on facial expression. Whereas generally more medially, even if we're using a hyaluronic acid or a biostimulator, I'd be nervous about injecting a lot of volume on top of the muscles of facial expression. So this line of ligaments is an important line to consider for all kinds of injections, especially biostimulatory fillers. So just to confirm, the way in which the aging process happens in the posterior aspect of the midface or the lateral midface, because these layers are concentric, the skin, the fat, the muscle, we start to get this passive sagging, and we can start to get this appearance of an early jowl. And it's exactly for this same reason that we have these concentric layers that we can also think about repositioning as our strategy. And one of the advantages of a biostimulatory injectable is we can start to think about not just treating volume loss, but also repositioning the tissues this way to try and improve the main concern for Charlotte. In addition, I'm going to continue my biostimulatory treatment all the way to the chin. And the reason I would do that in this case is I noticed that I want to create a little bit more projection in the chin, if it's possible, just a little anterior projection. But I'm also going to try and create the same improvement to the skin in the chin and the medial aspects of the jawline. And this will then help the entire appearance of this transition from the lateral midface all the way through to the chin. This area is very tightly adherent to the underlying muscle and fat. And so you'll notice that when I'm injecting in this part of the face, there's a lot of space for my cannula to pass. But as I start to move medial to this mandibular ligament, it's going to be a bit more tight and a bit more contained, but we can still use a cannula to try and treat into layer 2 to try and improve the overall transition from the jawline through to the chin. So that's going to be my strategy for the biostimulatory effects. It's worth remembering that we can use Ellansé anywhere. We can generally inject it under the skin or deep to the muscle down onto bone in certain areas of the face. In this case, it makes most sense to treat here. There are some areas that we would not use biostimulators, okay? We wouldn't use the biostimulators in the lips and the very perioral region, and the same applies to the under eye region, and that's because of the mobility of those tissues and the risk of forming nodules. I'd also be nervous about injecting a non-dissolvable injectable in the extremely, I would say the relatively higher risk zones of the nose and the glabella. So those would be my no-go zones for injecting Ellansé personally. The final depth that we need to be nervous about, or we shouldn't go to, is the intradermal depth. And we don't want to, as much as it's good to get a biostimulator on the underside of the dermis, we don't want to be injecting inside the dermis, which could cause very firm nodules on the surface of the skin. Otherwise, I'm going to show you my injection technique for using biostimulators generally to get the best results and to avoid complications. And as I do that, I've got Dr. Harriet with me, who's going to be talking through some of the science of the products at the same time.
So, Dr. Tristan, what's going to be your sequence to approach?
So I think we'll follow the same strategies we always follow with injectables. We'll start from the top down and we'll work lateral to medial, which means that generally I'm going to start back up here, temporal and the lateral aspect of the zygomatic arch. Then I'll treat the preauricular area, posterior aspects of the jawline, and we'll work our way towards the chin. What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results. So I'm going to be using a 22 gauge cannula. So if you could help me with that, Harriet. Okay, turn this way for me, Charlotte. Thank you. So we're going to make an entry point here. Tiny scratch. Perfect. Okay, so here I've got my first syringe of Ellansé mixed with the lidocaine, and this is the kind of depth we want to be in to get the best stimulation for the dermis. And you'll notice my injection technique here, that I'm just gently pushing through the little fibrous septa that divide the subcutaneous fat. And it's really important that we do check for depth here. Turn this way a bit more. What we see on ultrasound is that often the injectables can end up in the parotid gland. And one of the main reasons I'm using a 22 gauge cannula here is because it helps me to control depth better. I'm more likely to stay in the same injection plane as I'm injecting and not likely to dive into the underlying important structures in this part of the face.
I often find that slightly angling your cannula so your wrist is slightly down and the cannula tip is slightly up just can help if you feel like you're getting tangled in some of those fibrous bands that are a bit more likely to pull your cannula down and then enter into that parotid tissue.
And you see a lot of this on ultrasound as you're starting to scan our patients?
Absolutely. I think previously we always assumed the patient would feel it, or we would feel it as injectors if our cannula slipped into that glandular tissue in the parotid. But actually, patients don't seem to notice it. We definitely can't feel it when we've got the cannula there. So we need to do everything that we can to try and stay superficial.
Agreed. So one of the things I'm just showing you here is that as we start to change direction with the cannula, it's a mistake to think you can go from here to here. Okay. What we need to do is we need to almost entirely come out to be able to change direction and then be able to move into part of the jawline here that I want to try and treat. The other thing is that when I'm injecting, I'm doing a linear thread and then I'm going to stop here. I'm not injecting this initial centimeter with Biostimulator. And that's because as I will continually treat this little part of the tissue, the risk with a biostimulator is that I create a nodule because I'm injecting over the same place multiple times. And so I'm very careful that I'm thinking exactly where my biostimulator has previously gone to avoid the risk of nodules. And I think it's worth us talking about that. I think people worry about biostimulators as the fact that they can't be dissolved and we have these vascular risks. But the real risk that I think people need to be aware of is the risk of causing nodules. And Harriet, do you want to talk us a bit through what you think about those?
Absolutely. That's a much more common risk that we'd see with these types of fillers in the biostimulatory family than actually causing vascular adverse events. The substance that you're injecting now is made up of polycaprolactone, which actually is very smooth to inject. It's little spheres of very stabilized polymer that's sitting within almost like a water gel. It's made up of carboxymethyl cellulose, which we use in all sorts of different ingredients all across medicine. And it makes this very smooth gel for you to inject. And you can see now through the skin, it's going very nicely and integrating into the tissues. But you're right, what you don't want to do is have too much of this substance aggregating or clumping in one area, because the long-term effect of these treatments, the magic of why we like them, is that they do have an inflammatory effect on the tissues and they will start to stimulate some of that collagen, which is great. That's exactly what we're after. But in small amounts, balanced across the tissues, having too greater inflammatory reaction in one area, that's when you're going to start to see your nodules. And the difficulty with these products is that they tend to form these very clever little walled off nodules, which can become really difficult for us to penetrate and to break down. It's not impossible, but they're not easy. So always, first principles, prevention is key. So the techniques of injecting little amounts, not all in one area, nice and balanced out, not treating too superficially into that dermis. So you have to be really careful with your entry points of your needles and when you're withdrawing, that you're not injecting any of the substance. All of those things can help to minimize the formation of those nodules.
Perfect. Thank you, Harriet. What I've been doing just over this last minute or so is I've been trying to create some subdermal structure along the jaw, along the cheekbone here, to try and create this lovely feminine angulation to the lateral aspect of the cheeks. And so I'm just focusing my injections along the cheekbone where I see it, but treating in the subcutaneous depth. And we'll see this in a few months' time. Hopefully we'll have noticed an improvement to the definition along the cheekbone. Again, I'm following the principles Harriet's mentioned, where I'm not creating a singular large nodule of this product in any given place, and I'm constantly moving the cannula as I treat. But that was me injecting our first treatment of Ellansé. And how was that? Was that okay?
It was okay.
Comfortable? Great. And what I'm going to do now is I'm just going to take the opportunity to just feel under the skin, make sure I've got a nice even spread of the gel. And I've treated this entire lateral aspect of the midface. And even though this isn't a representative view of how the ultimate result would look like, it's important for people to see what people look like immediately afterwards. So if you can just sit up and look into the camera for us. Perhaps you can notice where I have injected this gel on this side, where you can see a little bit of the cheekbone that I've created, and you can see a little bit of lifting and fullness on that side, which is then going to start the biostimulatory process over the coming weeks and months.